Welcome to 52 Questions. I'm Shannon Weber, Director of Hive. Every year, Hive answers hundreds of questions from patients, their partners, and providers. And each week in 2018, we're bringing you one of those frequently asked questions in video format. Have a question? Let us know. We'd love to answer it for you. So for this week's question, I've come to the Positive Women's Network to talk with Naina, who knows all the good things, to answer this question. So Naina, if you'd introduce yourself. And the question that has come in is, how does U=U impact reproductive health?
Great question. Hi, I'm Naina. I'm Executive Director of Positive Women's Network USA. We are a national membership body of women living with HIV in the US, inclusive of both cis and trans women. And I'm also a woman living with HIV. I was diagnosed in 2002. So I also come with some personal experience. How does U=U impact reproductive health? I think U=U offers huge opportunities for really thinking differently about reproductive health and reproductive rights for people living with HIV of all genders. So one of the really exciting opportunities that's presented by U=U is this understanding that we can really destigmatize sex for people living with HIV. So, kind of like in the old days, we used to say sex was protected if you're using a condom. Today, we know that sex is actually protected for people living with HIV when we are virally suppressed. That is a form of protection. So, this opens up a lot of possibility for people living with HIV and our partners to think about what we might want to do differently. And some of that is around our right to enjoy sex, and some of that might be around our desires around parenting. Conception, natural conception is totally an option. When the information about U=U really gives individuals and couples the opportunity to make informed decisions about how they might want to go about the process of becoming parents, if that's what they want to do.
And how, one thing, I wonder how it changes the kind of historical way in which people living with HIV have been messaged about their reproductive health options, because it does come with this history.
Absolutely. So one of the things we see both for all people living with HIV, but particularly for women, is that we get really shamed about our sexuality, even at the moment of diagnosis. So there could be lots of questions like, how did you get it? How do you think you got it? There are lots of words that get thrown around, like, did you have lots of partners? Were you promiscuous? Did you make bad decisions? And as people living with HIV, a lot of the time we internalize that stuff, and we start to feel a lot of negativity about our own sexual behavior, even, for no real reason, but mostly because some provider somewhere or some healthcare person somewhere thought that we had done something wrong and judged us. And so even today, although we know that when you're virally suppressed, you can't transmit, a lot of providers aren't really asking their patients or clients what they're doing to protect themselves from other STIs and pregnancy, and what they're doing to protect their partners. And so we might be asked, are you using condoms? But we might not be asked a question like, what other measures are you taking? Because maybe I'm not using condoms, but maybe I'm on the pill, and maybe I'm keeping my viral load suppressed. And that's how I'm protecting myself against pregnancy. And maybe I have open communication with my partner, and I have an understanding that we're in a closed monogamous relationship. So I know that other STIs are not coming into the relationship. So, it kind of like opens up the kinds of conversations that can happen. But I think one of the reasons that sexuality of women living with HIV in the US in particular has been so stigmatized is because it comes on this legacy of historically kind of surveilling and trying to control the way that women of color, especially Black and brown women in this country, make decisions about our reproductive futures, right? So literally, if you go back to the days of slavery, for example, white slave owners had a very vested interest in controlling the reproductive futures of their female slaves, like when they would get pregnant, if they would get pregnant, if they were to have children, because those children became their property, right? But also if somebody is pregnant, that might affect the kinds of work they can do and when they can do certain kinds of work and things like that. So control of the reproductive destiny of women of color in this country is not something new. The way that HIV in particular gets used, HIV, which disproportionately impacts Black and brown women here in the US, right, also gets used as just another tool to shame women about our own sexuality, about our own sexual decisions. There also many women living with HIV had like forced tubal ligations or have been coerced into sterilization, and there are high rates of regret around that if you look at data on women living with HIV. So many women who felt like they couldn't have babies, or were told that they couldn't, or who were involuntarily sterilized. And that is also something that has a tremendous history in this country, is forced sterilization, tubal ligations, and kind of trying to control how, when, and where Black and brown women do and do not have children, and the rights that we have to make decisions about that ourselves. A lot of this gets connected to discussions about the safety net and benefits, right? So, so these ideas that get put out there, these kind of stories, as if these kind of stories that people of color, women of color in particular, are like living off the system in ways when we choose to have kids, in a system that makes it very hard for us to find jobs that pay well, that makes it hard to like find resources for childcare and to eat healthy. In many other countries, those things are just a human right. It's a human right to have healthy food. It's a human right to have months of like parental leave after you give birth. These are just things we don't have in the US. It's a human right to have healthcare. Today, that's all being taken away. So this sort of like demonizing of sexuality of people living with HIV is connected to all of that. It's just another tool in the toolbox. And if you look at the data, it's real clear. Just, going back to this thing about the safety net and public benefits. It's not primarily people of color who are using public benefits. I think that's like an important point to clarify. There are many low-income white people who need these benefits too, and they absolutely should have them, as we all should.
You are awesome. Thank you for joining us this week for 52 Questions. Join us next week where we'll answer the question, what is reproductive justice? Have a good week.
Thanks for having me.